Problems associated with our mouth, jaws, teeth, and facial area can be caused from a variety of reasons. We spoke with orthognathic surgeon Dr. Dale Bloomquist in Seattle, who is an emeritus associate professor of oral and maxillofacial surgery at the University of Washington, about some of the conditions they treat.
Oral maxillofacial surgeons are specialists that start out in dentistry, go on and generally do medicine nowadays, and they work on oral lesions as well as teeth, jaws, facial problems. So as a whole, we cover all of the facial skeleton. Soft tissue has come down to the neck.
If our jaws don't grow normally, multiple problems may develop, including difficulty with chewing and speaking, facial and jaw pain, and even sleep apnea. In many of these cases, orthognathic or jaw surgery may be needed, and Dr. Bloomquist is an internationally recognized expert in this area who limits his practice to orthognathic surgery.
Orthognathic surgery is a subspecialty of oral maxillofacial surgery that deals with facial reconstruction, generally in congenital and developmental problems of the facial skeleton. These are generally the types of cuts, the bone cuts we call osteotomies, that are made. In the lower jaw, we have the mandibular sagittal osteotomy, so then we can move the front part of the jaw forward, backwards, and actually rotate it any way we want.
Orthognathic surgery now not only requires a complete oral and facial exam, but also three-dimensional radiographs and photographs. Dr. Bloomquist's office is one of the few in the United States that use both imaging systems in the patient workup.
This is one of the more newest imaging programs called Voltus, in which we can take the patient's 3D photo, and then underneath it we can actually move the soft tissue out of the way and see the facial skeleton and the different elements that we're moving. In this particular case, we moved the lower jaw, both the vertical parts of the jaw as well as the maxilla and their teeth. So in this way, we can then demonstrate to the patient exactly the changes made in 3 dimensions, and then we can show what exactly the soft tissue will look like after surgery.
Dr. Bloomquist and his team offers superior treatments and the highest level of quality patient care.